Hello, everyone. We're going to wait just a minute for everyone to be let into the webinar. Okay, I'm going to go ahead and get started. My name is Christy Sullivan. I'm the Secretary of the American Society for Cellular and Computational Toxicology. Welcome to our webinar series, the February version. This series is presented by ASCCT and the European Society for Toxicology in Vitro, like all of our webinars. I want to encourage you to visit our websites to learn more about our organizations and consider becoming a member to support programs like this webinar series. You can also join our mailing list for job and event announcements and other fun, interesting stuff related to in vitro and in silico toxicology. The webinar is recorded and the recording will be posted on the ASCCT website a few days from now. In the webinar platform, you can ask questions of the presenter using the Q&A feature. That should be in a toolbar at the bottom of your screen. We will have a Q&A period after each presentation is finished. Add your questions at any time. It's going to go fairly quick because we have 3 presentations. So as they occur to you, feel free to put them in the Q&A module. We also have enabled closed captions, and you can turn them on or off if you would like. And please say hello in the chat and let us know where you're joining from. First, I'm going to give you a few updates of events happening in the community. The ESTIV annual meeting is coming up this early summer, and that's in Maastricht. And there is still early bird registration open, so go ahead and take advantage of that. We will have the 15th annual ASCCT meeting in October of this year. It's going to be in Research Triangle Park. We're almost set on a venue, but we'll announce that as soon as we can. And it's probably going to be October 28th through the 30th. In addition, we'll have a Society for Adverse Outcome Pathways ancillary meeting the day before. The deadlines are going to be session and CE proposals will be due on May 1st, and you can see we'll have throughout the summer some additional opportunities to submit your work, to present, and apply for travel awards also. A couple of other upcoming events that our associated organizations are running. First of all, I believe the 4th edition of the Summer Immersion for Innovative Approaches in Science is going to be happening in Baltimore in June. So please log on to that website to find out more. PCRM and sometimes my organization IFVS have collaborated on an ongoing webinar series called Neura en Español. And the next one is going to be coming up next week. So please feel free to share that with your Spanish-speaking colleagues. And on Friday, because of the government shutdown, we were unable to present this session during the 14th annual meeting. So we've managed to arrange for all of the presenters to come and present their work on Friday. So hopefully you can join. We have an extensive calendar of events, webinars, and other types of events. So please go to our website to find out more and to register. We have a number of webinars scheduled for the next several months. As you'll find out, the focus for the beginning of the year is to present and highlight the work of some of the people who have won awards at the 14th annual meeting. We present a number of awards judged during the meeting, and then we like to talk about their work a little bit and give them a chance to give us a chance to learn more about it and collaborate with them. So for today, we have 3 presenters, and I'm going to introduce them all, and then we'll get started with the presenters. First of all, we have Prachi Pradeep. She's going to be presenting a NAM-based assessment to classify chemicals for systemic toxicity effects. Prachi is a computational toxicologist in the Department of Chemicals and Product Safety at the German Federal Institute for Risk Assessment. With over a decade of experience in cheminformatics and bioinformatics, she brings a strong data science perspective to chemical safety assessment. Her research focuses on the development and validation of predictive models, the regulatory integration of new approach methodologies, and the characterization of data variability and uncertainty to support robust science-based risk assessment. She holds a master's degree in bioinformatics and a PhD in computational sciences, completed in collaboration with the U.S. Food and Drug Administration's Center for Devices and Radiological Health, and undertook postdoctoral training at the U.S. EPA's Center for Computational Toxicology and Exposure. Our second presenter, and I forgot to mention, Prachi also won our Ed Carney Predictive Toxicology Award. The next presenter is Kenzie Pereira. She is presenting Predictivity Assessment of the Human Thyroid Microtissue Assay. Kenzie is an ORISE postdoctoral participant within the US EPA Office of Chemical Safety and Pollution Prevention and the Endocrine Disruptor Screening Program. She is a Louisiana native and earned her PhD from Duquesne University. Her background includes integrative research on vertebrate immunity, stress physiology, disease, and environmental drivers of health. Her current work focuses on evaluating the predictive capacity of an in vitro human thyroid microtissue assay as part of new approach method pre-validation, supporting human relevant mechanistically informed screening for endocrine disrupting chemicals. And then finally, our third presenter is Raymond Hu, who will be presenting the development of a curated database of skin sensitizers released from medical devices. He's won the ASCCT 14th Annual Meeting Poster Award recipient. He's a master's student in toxicology at Johns Hopkins University with academic training in occupational health and computational toxicology. His research interests focus on chronic disease-related consumer products, integrating computational approaches with clinical evidence to improve product safety and risk assessment. He holds a BSN degree and has prior bedside clinical experience, bringing a clinically grounded perspective to toxicological risk assessment and exposure-related health outcomes. He is currently working with Risk Science Consortium, LLC, a Johns Hopkins University-affiliated clinic, to develop a curated database of skin sensitizers released from medical devices. And I'm sorry, I forgot to mention that Dr. Pereira also won the Suzanne Fitzpatrick Student Travel Award. Okay, with that, I will turn it over to our first presenter, which will be Dr. Pradeep.
Hi, everyone. Let me start by trying to share my screen. And thanks, Christy, for the introduction, and also Allison for inviting me to present today on this platform. And to everyone attending, thank you for joining in. Hope you'll enjoy the series of talks here. Okay, are you able to see my screen here?
Yes.
Perfect. Okay, so like Christy mentioned, I'm here today to present on an NAM-based assessment framework for classification of chemicals for systemic toxicity potential. The work I'm presenting here is basically in response to this EPAA Design-a-thon for Human Systemic Toxicity. The EPAA was an organization established in 2005, and it's a collaboration between the European Union and industry stakeholders across 9 sectors. They have a broad vision which basically covers replacement, reduction, and refinement of animal use for assessments and regulatory requirements, and through just trying to make sure it's overall targeted towards the adoption of 3 Rs in risk assessment. As part of their overall vision, they launched this EPA NAM Design-a-thon in 2023, where the goal was to invite participants to submit a NAM-based solution where they assign a level of concern, high, medium, and low, for systemic toxicity potential for a list of reference chemicals based on the toxicodynamic and toxicokinetic data that is available through different NAM sources. The motivation behind this design-a-thon also comes from this vision of Chemicals 2.0, which is a vision towards a future regulatory framework for chemicals in the European Union for their prioritization in an effort to go from the current status of how it is done to being more protective in the future, just trying to have a more forward-looking framework. So here the idea is that we develop a system which is calibrated based on the already classified data. So you have the same decisions. We don't change the decisions, but we try to find a way to classify chemicals based on different NAM data according to this already available CNL data. And then we kind of apply this to all the chemicals in the future that are available in the market. And the idea is that we want to move towards not tonnage-based assessment, but based on the priority. So we prioritize these substances in these three different classes: high, medium, low. And the chemicals that would be green, you can just use them, innovate with them without any restriction. The ones in the medium category, they could be restricted via safe limits. And then the ones that are in red obviously would be banned or maybe prioritized for future testing. So as part of this design-a-thon, we at BFR also submitted a solution, and we wanted to do a simple and transparent stepwise workflow. So what we suggested was using very simple open source tools that are publicly available to classify these reference set of chemicals for systemic toxicity using three different lines of evidence. So we wanted to use in vitro data, amplify it with in silico data, and then use data gap filling using read across when there was absolutely no in vitro data available. We submitted this work to the design-a-thon, and since then it has evolved a little bit, but then this is basically what I'm going to present here. So like I said, this work uses open source computational tools and data sources, and we wanted to keep it very simple so it's easily accessible and approachable and reproducible by anyone who wants to do this. To that end, we tried to use the integrated chemical environment, the ICE tool that's developed by the NTP and ICTM group, and they provide it as a web-based tool that integrates in vivo in vitro data, chemical properties, predicted bioactivity, and different computational tools to support chemical safety assessment. This tool was particularly used to support two lines of evidence, the in vitro line of evidence and the read across line of evidence. Then the second tool that we use is this QSAR in vivo points of departure model, which is a QSAR model which comes in as the in silico line of evidence. And this is a structure-based QSAR model that has been trained on about 3,500 chemicals with in vivo repeat dose toxicity data, which is hosted by the US EPA's ToxvalDB. So that's the database. Within ICE, we use this IVIV module, which is basically an in vitro to in vivo extrapolation tool. It implements the libraries within the HTTK-ARC package developed by the EPA, but then it's an easy to use interface. You can translate your in vitro assay data into in vivo equivalent doses using just a click of a button. And so through this, we estimate two quantities here. So we try to understand the hazard potential, and then we try to understand the systemic bioavailability as a measure for TK. And then for the read across line of evidence, we use a chemical quest module of the tool, and this basically implements a structural similarity searching fingerprint, which is based on Saga fingerprints. And they allow us to search for similar chemicals, so analogs for different targets. And then it allows you to source this data to the IVIV module so you can extract the relevant TD and TK data. The QSAR model here was then used to make a prediction for in vivo PODs, which are expressed as external oral dose and mEq per kg per day. I'll talk a little bit about all these three different lines of evidence a little bit in the forthcoming slides. So the first line of evidence, which we play the most weightage on, is the in vitro bioactivity and IVIV data. The idea here is to support in vivo support hazard estimation using bioactivity data. So again, we try to do the toxicodynamics, the TD, and then the TK. The data that we use here through this tool is the high throughput HTS data from the Tox21 and ToxCas data sources. What we were able to do here was when we put in our relevant list of reference chemicals in the tool with the screenshot on the right, you can select the kind of assays you want to go through. And since we were looking at systemic tox data, we use their mode of action module here to select assays which we think would be relevant to systemic toxicity. Once we select those assays, we can just click the button and then route it through the tool. And it gives us all the compiled AC50 values and also pipes it through the IVIV module to give us estimate for the toxicokinetics, so the CSS later on. Since each chemical can have more than one source of in vitro data, we basically compile all the available AC50 values, and then as a conservative assessment, we took the 5th percentile of the distribution as a conservative point of departure for hazard estimation here. For the CSS, the model that was run was the single compartment model. It's basically implemented in the HTTKR package, but also implemented in ICE in the background, so you can get the data as is. We made the default assumptions of the model. So the dose is 1 mg per kg per day, oral route in a human body with the default 70 kilogram weight. And for the FISCM parameters that go into the model, they were also default. So some of them were from the opera prediction and some of them were measured data. The second line of evidence we explored is the QSAR-based in silico predictions for repeat dose toxicity points of departure. Like I mentioned earlier, this is a QSAR model that was built on a set of about 3,500 chemicals from the ToxValDB. And what it does is it takes in structure information and then it gives a list of in vivo PODs, a distribution of that, and a confidence interval around for each chemical. Since these predicted PODs kind of inherently take care of the TD and TK aspects, so this output from the model was basically directly taken for the concerned category assignment. So we did not split it into two, we just used it as a final value for assessment. Lastly, we use the third line of evidence, which is read across for data gap filling. So here we come to read across only when there is absolutely no in vitro data available for a chemical. And then we go to the ICE chemical quest tool. Here we can put a list of our identifiers and put in the default coefficients or play around with the similarity we want to. So we use a similarity coefficient of 0.7 or greater and a maximum of 10 hits per chemical using the Sagar features. So once we have a list of analogs for each of these target substances, this data can then be routed to the IVIV module, and then we can extract the TD and TK data as I explained in the slide for in vitro data earlier. And once we have the data, it is used for read across, basically average weighted analysis to derive values for these target chemicals based on the analog data from the tool. Okay, so once we had all the data from these three different lines of evidence, we had to convert it into a concern level category for each substance based on this classification matrix. So as I mentioned earlier, for TD and TK, we can basically look at this matrix and come up with an overall classification. But for the QSAR POD values, we directly assign a high, medium, low based on the final outcome. We assume that the reference set of chemicals was, or it was informed to us that it is equally distributed across all the different categories. So we kind of built up upon that assumption. It's that we assume that all these substances would be equally distributed in these classes. So when we started to do the concern categorization, we kind of decided to transform these values, and we did it on a log scale. And so just break it into tertiles. So, and create boundaries in three different classes and then assign high, medium, low based on that. And this would be a little bit more clearer on this next slide here. So for the TD data, this is the log transform data distribution here, and we basically divide it into three bins. And based on these boundaries, we classify chemicals in high, medium, or low category based on where they fall in these bins. Similarly, for TK, we did that same, and then for the QSAR values, we took the values as such and then divided it into the high, medium, and low classes. So once we had these concern category classifications for the substances, we also wanted to kind of make the final decision, because now we have data from these three sources and we need to integrate them together to come up with a final concern category. It wasn't rocket science here. It was just simply based on the placing more weightage on the quality of data, and then we tried to keep it very simple. So we place the highest evidence on in vitro data. If that's not available, we go to QSAR data, and if that's not available, we go to the read across category. So we simply check if there is in vitro data, and then the final concern category is based on that concern category. If that's not available, we assign it as a QSAR derived concern category, and if that's not available, we just address it as read across or not categorized if there's absolutely no data. But since we have these three different lines of evidence, we also wanted to incorporate some confidence measures based on how these data sources agree or disagree with each other. So here, once we had assigned the final category, we basically go back and see where it was derived from. Was it from in vitro data, QSAR, or read across? In case of in vitro data, if we were able to obtain hazard data from more than 10 studies, we place high confidence of the data just based on the evidence here. When the number of studies is less than 10, we also look at if the concern category derived from the in vitro data, it actually matches the QSAR derived concern category. And in that case, we also place the evidence as high. If it does not agree, it places confidence as moderate. And I just noticed that my yes and no's are missing in this favorite. So bear along with me and I'll just guide you through it. So if it's yes, the confidence is high. If it's no, the confidence is moderate. Next, we go to the QSAR derived concern category, in case there is no in vitro data. So now we check if the concern category is the same as read across derived concern category. Do we have some more weightage on that? If yes, then we have moderate confidence. If no, we have limited confidence. And finally, when we go to read across derived concern category, there's basically no other supporting evidence, and then we assign low confidence to that data. So here on this chart, I'm trying to show how does our final concern category distribution look like. Based on this framework, we were able to assess almost 80% of the chemicals, which is nice because we wanted to have something which offers maximum coverage, and we are able to classify more number of chemicals versus less. So the intent was to cover as much space as we could possibly. However, within this, there was only coverage in the in vitro data sources. There was only 55% coverage for the set of reference chemicals. The QSAR model was able to predict 77%, and that's because for some of these chemicals, the relevant chemical descriptors could not be calculated, and so they could not be predicted by the tool. For read across, like I mentioned earlier, we only assessed it for chemicals that did not have any in vitro data. So it was only 67 substances, and out of those, only 13 were assessed through this route. So this brings about one of the important aspects around read across. The first one is trying to find suitable analogs for a substance. So when you have a target chemical, can you find structurally similar chemicals that are actually relevant? And then once you find those, is there any data on those substances? And that significantly reduces the prospects of using read across as a singular line of evidence. Overall, 50% of the predictions agreed between the first and second line of evidence. So in vitro data and the QSAR predictions, they were in agreement about 50% of the time, which is, I guess it's okay. And then overall, the same categories is about 37%. So all in all, we were able to classify 46 substances, which is almost 37% as high concern, 33% as medium concern, and 30% as low concern, which is not a surprise here because we basically came from the assumption that 1/3 of the data would belong to each of these categories. So we see that kind of a distribution here. But then does it really match with the current CNL classification? And when we did that, we realized that almost 32% of the data agrees with the current category classification. And we just wanted to dig a bit further on if we were less or more predictive in trying to do this in this manner. And so about 30% of the substances were less protective and about 35 were more protective. So overall, we had a feeling that, we developed this workflow, which is nice, simple, easy to follow. leveraging existing data and one of the biggest in vitro data sources that we have. But then it's the coverage is not outstanding, although we have a nice workflow. So in summary, I think I just wanted to say that we try to explore a framework that's structured. It is a NAM-based categorization approach that allows you to systematically prioritize these chemicals into different bins based on availability of data, and it explores different data avenues. So we are looking at in vitro bioactivity data, we are looking at IV predictions, QSAR models, read across, and there is a transparent logical workflow and confidence assigned with each of these predictions. However, what we also realize is that not all reference chemicals could be categorized due to limitations in availability of relevant data or the kind of chemicals that we are trying to work with here. So while there are technical limitations regarding tools, whether they can predict for a certain chemical or not, I think there's also this idea about the kind of data that we are using and whether it is relevant for this kind of an assessment, and that still needs to be demonstrated. So there are improvements that are needed for various aspects of both the TD and TK tools and associated data. And in these next two slides, I kind of try to list down these limitations, not saying that we can achieve everything or we have done anything, but we are trying to identify what are the areas we are lacking and what are the possible solutions that we can look at. For example, with regards to toxicodynamic properties, I mean, when we look at the in vitro bioactivity data, there's insufficient coverage of toxicity space when we look at human systemic toxicity. If you recall, it was only, I think, 60% of the data that we were able to look at. And then there's uncertainty related to individual assay results because there are so many assays and there's variability in the assay outcome. So we kind of have to look at that and perhaps explore this in vitro bioactivity data within an AOP network or understand a testing strategy for that. The next issue that comes is with the coverage for metabolites. So right now we don't have any way of doing that, but of course, if we were able to extend this using metabolically competent cells and have data accordingly, that could be expanded. The concern categories are just an overview of hazard, but they do not exactly provide any mechanistic information on how exactly it's happening. So that's a limitation on the method, I would say, not so much on the data, but it's also kind of draws from the data. So overall, there's I think there's lack of in vitro coverage, and that's the underlying problem if we are trying to use these NAM-based tools. If we try to go to in silico methods, so we looked at the QSAR model, but there's again this variability in animal data, and there's limited amount of data, which also restricts the QSAR models to perform as well as we want them to. And then, of course, the issue of chemical descriptors, so it's also limited by that. So we could potentially look towards new models for better curated data. And with respect to read across, again, like I mentioned earlier, it's a lack of relevant analogs and data availability for those relevant analogs. So these are a couple of things that we were able to jot down for the TD aspect. For TK aspect, I think we want to understand the kind of underlying model we use. So the PK model that we use is a one compartment model. It's a very simple model. It's probably not suitable for all kinds of chemicals. So looking at more advanced PPK models. And then again, there's a limitation in terms of the chemical space coverage because the properties that are intrinsic for these predictions, example, fraction and bound and clearance, these are not available for most of the substances owing to the nature of how this information is generated, so the kind of assays, but then also the predictive models are not that great for these kind of FISChem endpoints. The models also assume 100% bioavailability, but we don't know that for all the substances. So that's also one of the aspects that need to be refined in the future. So overall, we felt that this could probably have low regulatory acceptance, and it's not owing to any of these methods or the battery that we followed. It's just the kind of data we have. But it also gave us some confidence that we can start to develop these kind of integrated workflows. We can put all these data streams together. So it's not all lost. I think it's good, but we also want to look at the prospects that come out of here. And I think more number of case studies and just working together to advance this would just be probably the way to go. So with that, I want to stop talking and I want to thank you all for listening. But this is kind of an ongoing work, and any feedback, if you all have, would also be very appreciated. So I'm gonna stop sharing my screen here, and or should I keep sharing my screen in case you want me to go back to any of the slides?
Yeah, just in case.
Okay, yeah. So
Well, thanks, Prachi. That was a great presentation. I really like the sort of let's just try something out and see how it works and then refine it, right?
yeah,
Um, all right. There is a question which I'll ask you. Just a reminder, everyone, please put your questions in the Q&A and not in the chat. It's too hard to keep track of them in the chat. Okay, so the first question is, are you able to improve the predictivity of your of the framework if you start with the QSAR model and then use the in vitro data? Have you tried that out?
that's a great question. I think my gut feeling would say maybe no, because when we looked at the concordance between in vitro and QSAR models, it was about 50% or
Okay.
37%. And also, it kind of brings us back to another crucial point. I mean, do we want to, and are we ready to place trust in the QSAR predictions alone? And that's one thing that I have seen, recurrently. There's still this inhibition against trying to use these predictive models unless they're backed up with in vitro data. And I think the thing is, the weight of evidence always leans upon in vitro data.
Hmm.
So, in some ways, this is also a showcase for demonstrating that in vitro data is not always the best route to go, and we can probably build a case for introducing more in silico models in the future. But having said that, the predictivity with the QSAR model alone was also not superbly high in this case. So I don't know. It's an open question. I think it needs further interrogation, but it's a great point, and thank you.
Yeah. Second question is, can you elaborate a little on using 0.7 as the cutoff for Tanimoto coefficient? Did you try different values or is this a safe value for this application?
Again, a great question. I think these are things that can be fine-tuned. We did not try to play around with the thresholds. I mean, I did increase it to 0.8, 0.9, but then what happens is obviously you lose the number of analogs.
Yeah.
And since we are really very limited in the kind of data we are getting for read across, I try to keep the barrier as low as possible. So 0.7 is a reasonably accepted threshold. Again, it's something that has been empirically established. No one has really done these validation studies. In the past, we've tried to see if you start increasing the thresholds, how do the quality of analogs become? But there is also this idea of it's not just the threshold, it's also the chemical structure features that you're using for determination of these analogs. So Sagar fingerprints that embedded within the ICE framework are just one. But if you start looking at other features, you could also have different kind of analogs. For example, if there's more time to elaborate, I tried to look into the gender predictions. And when I looked at Genera, the problem with Genera was one that you cannot scale the prediction. So you have to go one chemical at a time in the beginning, and or you have to use a Python tool, which wasn't exactly working smoothly at the time, and we wanted to keep it simple. But the analogs that we got from Genera, which uses Morgan fingerprints, basically we got nothing for the couple of chemicals we tried. So it also depends on what fingerprints you're trying to use to generate these analogs.
Yeah.
So again, these are things that can be tinkered with. We didn't do very much here to give you a definite answer if it improved or not. But yeah, I don't think there's a clear answer on that.
Yeah. Okay. Thank you. We have one more question. I think we can fit it in. You mentioned the IVIVE model, and I'm wondering what the level of performance was for this model. For example, for the test set, it was the R squared correlation coefficient a range of 0.75, 0.85. Yeah, there's just recognizing the difficulty of building these IVIVE models, but just wondering if you have any information on that.
I don't remember on top of my head, but I don't seem to recall. I mean, I don't understand the question. the R squared, because for PVPK, the validation studies, I'm not sure if there's some evaluation like that.
Hmm.
Yeah, so maybe I don't understand the question very well here, but if you can maybe go into a bit more detail on what you're trying to understand, that might help me.
Okay. We will connect you with the person who's asking the question.
Yeah, we can take it offline for sure. Yeah, I don't think I completely understand it, and I don't want to belabor here. So,
Okay. Well, thank you again so much for your presentation. We'll move on to the next presenter, Dr. Pereira. And also just to mention, Prachi is in Germany, and so it's getting late, and so she's going to sign off. But if we have additional questions for her, we'll send those over.
absolutely. Thank you, everyone, once again, and feel free to reach out if you do have any questions or suggestions. And hope you have a great rest of the seminar.
Yeah.
Thanks. Bye-bye.
Take care.
Bye.
Kenzie, we'll turn it over to you now.
All right. I believe it's this one. Okay. Are you seeing it change?
Not yet. Oh, there it comes.
Okay. And if I, all right.
Looks full screen to me. Okay, go ahead.
Okay. Good morning, and thank you everyone for attending the webinar today. My name is Kenzie Pereira, and I'm an ORISE postdoc in the EPA Office of Chemical Safety and Pollution Prevention in North Carolina. Today, I'll be presenting work evaluating the predictive performance of an in vitro assay for identifying and evaluating thyroid disruptive chemicals, the human thyroid microtissue assay, or HTMT assay for short. Before we get started, I would like to emphasize that the views expressed within this presentation are those of the author and do not necessarily reflect the views of the US EPA. All right, so within the endocrine disruptor screening program, existing thyroid new approach methods primarily measure chemical interactions with upstream molecular initiating events, like thyroid peroxidase or TPO, and the sodium iodide symporter NIS. However, these interactions do not always translate to disruption of thyroid hormone synthesis. So the HTMT assay addresses this gap by directly measuring the production of the thyroid hormone thyroxine, or T4, in a human relevant in vitro model. Until now, the HTMT assay has completed several stages of development, including proof of concept work, technical standardization, and more recently, interlaboratory validation, assessing method reproducibility and transferability across different labs. The current work focuses on an intra-laboratory evaluation of the assay's ability to capture certain mechanisms of T4 disruption and predictive performance using a broad chemical test set. Ultimately, the goal of this effort is to establish validated human-relevant assay capable of identifying thyroid disruptive chemicals. To give you just kind of a broad scale overview of the standard HTMT assay workflow, this assay is conducted over a 14-day period. It begins with direct seeding of primary thyrocytes into the wells of a 96 well plate, followed by a maturation period to support functional hormone synthesis prior to chemical exposure. And then following this maturation period, chemical exposures are administered across 3 exposure events with imaging throughout to monitor microtissue morphology. At assay termination on day 14, medium is collected for T4 quantification and tissue viability is assessed to account for potential cytotoxicity. Previous work established a set of reference chemicals with known mechanisms of action that are also included to confirm expected biological responses and to evaluate assay proficiency. For this study, there were three main objectives. The first was to assess the predictive accuracy of the HTMT assay across an expanded chemical test set. The second was to evaluate technical performance across experimental replicates. And the third was to quantify predictive performance using metrics including sensitivity, specificity, and balanced accuracy. The chemical test set consisted of 49 putative thyroid active and inactive chemicals that were selected based on literature-supported thyroid pathway activity. A priori classifications were assigned based on evidence of T4 disruption or mechanistic association with thyroid hormone synthesis. And now I'll describe the experimental design used to test each of these predictions. The HTMT assay was performed across 4 experimental timelines, with each replicate consisting of 6 96-well plates to accommodate the full chemical test set. Pooled primary human thyrocytes were seated in TSH-free medium within the inner wells of each plate. TSH supplemented and unsupplemented controls were included on each plate, and because TSH, or thyroid stimulating hormone, promotes microtissue formation and thyroid hormone production, these control conditions provided internal controls for evaluating stimulated hormone production and technical performance. A reference chemical control, methimazole, which is an antithyroid drug and known TPO inhibitor, was also included on each plate in a 6 concentration series to confirm assay sensitivity to T4 disruption and to evaluate technical performance across plate and experimental replicates. For test chemicals, each plate included 8 unique chemicals alphabetically randomized and tested across a 6-point 10-fold serial dilution with maximum within well concentrations ranging from 25 to 100 micromolar, depending on chemical specific solubility limits. To provide an overview of the full experimental workflow, the HTMT assay was performed as followed. On day 0, primary human thyrocytes pooled from 5 qualified donors were seated into each of the 96 well plates. Following this 6-day maturation period, wells were treated with TSH supplemented or TSH-free medium containing either the vehicle, a reference chemical control, or test chemical concentrations on days 8, 10, and 12. On day 14, medium was collected for T4 quantification using commercial ELISA kits, and tissue viability was assessed using the cell titer glow ATP assay as a measure of biomass and to assess cytotoxicity. Following experimental execution, assay data were analyzed in a 3-step process to evaluate technical performance and predictive accuracy. Assay performance was first evaluated against predefined acceptance criteria, including dynamic range, precision, and screening quality, alongside biological performance indicators such as TSH-induced biomass increases and donor cohort qualification for T4 production. The reference chemical control, methimazole, was also evaluated against an established proficiency benchmark. T4 and viability endpoints were processed using EPA ToxCast pipeline to assign a hit call for each chemical, which was used to distinguish active from inactive chemicals. Cytotoxic responses were excluded from predictivity assessment to reduce the likelihood of attributing reductions in T4 production to nonspecific effects of compromised tissue viability. For the remaining non-cytotoxic chemicals, assay outcomes for the T4 endpoint were compared to a priori classifications within a confusion matrix framework to calculate predictive performance metrics. Following analysis, all experimental replicates met predefined assay acceptance criteria for T4, including dynamic range. This describes the assay's ability to distinguish stimulated from unstimulated T4 production, in this case, TSH stimulation. Precision, which captures the consistency of measurements across replicate wells, and overall screening quality, which incorporates signal separation and variability into a single metric. Additionally, the reference chemical control methimazole demonstrated a dose-dependent response that was consistent with established proficiency benchmark ranges. Together, these findings indicate that the assay performed as expected across experimental replicates and was responsive to known inhibitors of thyroid hormone synthesis. Okay. As expected, if we look here, TSH significantly increased microtissue biomass in the CT2 control relative to the TSH-free CT1 control. If you look at the images captured on day 14, so these are images of a single well with this dark center in the middle representing the center of the well. And these dark spherical structures that you're seeing in here are microtissues. So what you can see is that you can see in the CT2 image, the presence of larger and more abundant microtissues compared to the CT1 group at the top. In addition, T4 production was also higher in the CT control group compared to the CT1 and exceeded the acceptance criterion for T4 production. And together, these findings indicate that donor qualification for T4 production was maintained following pooling of multiple donors. Okay. Hold on, I'm having trouble getting my thing to, all right, there we go. Now that we've established the technical performance of the assay, we can take a look closer at how individual chemical responses aligned with their a priori classifications. Before we start, I'll briefly orient you to how to read these plots. So chemicals predicted to be T4 disruptive or positive are shown in the left blue panel, while predicted non-disruptive or negative chemicals are shown in the right yellow panel. Blue points within these panels represent T4 activity. Gray points represent non-cytotoxic viability responses, and red points indicate cytotoxic effects. Here we go. So overall, assay outcomes for most of the chemicals were consistent with their a priori classification. Most predicted positives exhibited a measurable T4 activity, while most predicted negatives did not. These discordant responses among the predicted negatives were primarily associated with cytotoxicity, as indicated by the red dots within this section. And this suggests that reductions in T4 production from these chemicals may just reflect compromised tissue viability rather than pathway-specific disruption. And so these observations informed the subsequent predictivity assessment within the non-cytotoxic chemical subset. So based on comparison of assay outcomes for the T4 endpoint to a priori classifications within the non-cytotoxic chemical subset, the HTMT assay identified T4 disruptive chemicals with 68% sensitivity and 100% specificity, where sensitivity just reflects the proportion of correctly identified T4 disruptive chemicals or positives, while the specificity reflects the proportion of correctly identified non-disruptive or negative chemicals. And within this non-cytotoxic subset, the assay correctly classified 17 of the 25 a priori T4 positive chemicals and all 15 of a priori T4 negative chemicals. These results correspond to a balanced accuracy of 84%, and this just represents the calculated mean of sensitivity and specificity. So, consistent with the objectives of this study, intralaboratory validation of the HTMT assay demonstrated reliable predictive performance for identifying chemicals that disrupt T4 synthesis. In addition, these findings advance thyroid new approach methods by addressing a key event gap in the thyroid adverse outcome pathway through functional assessment of hormone synthesis disruption. The assay also supports robustness and reproducibility, as donor qualification was maintained across the pooled donor cohort, and assay performance consistently met predefined acceptance criteria and proficiency benchmarks. And with that, I would like to acknowledge my mentors and collaborators at EPA OCSPP and former ORD, as well as our computational and data analysis support team. And lastly, this research was conducted under an ORISE fellowship at the US EPA. And thank you everyone for your time and for joining, and I'll happily take any questions.
Great. Thank you so much, Dr. Pereira. I don't see any questions coming through yet, but we'll give, oh, there we go. Can extracts, such as from medical devices, be tested in the assay? And some additional, remembering only vaguely how the thyroid interplays with endocrine glands, can the testing of this type of cells conclude absence of endocrine disruptors? So 2 questions. If you open up the Q&A, you can see them if that helps.
Okay. Yeah, I'm trying to get back to the Zoom screen because I minimized it. Let's see. Hold on. Okay, so I'll just answer the first part of the question. So I don't see why any extractables from devices couldn't be tested as long as those chemicals were known. Because essentially what we're doing is, regardless of what we're adding to the system, we're testing whether or not that added chemical has any effect on thyroid synthesis. And so it's not limited to only the chemicals that we tested or only, chemicals that have evidence for thyroid activity, because ultimately we want to be able to use this assay as part of the battery of assays for assessing unknown chemicals for potential activity in the thyroid system.
Yeah, okay, that makes sense. And I think did you find it, or did you want me to reread it?
Yeah, could you reread it, please?
Yeah, the second one, they're essentially asking if this assay covers all different endocrine disruptor mechanisms, I think.
Okay. So a lot of the in vitro assays that focus on molecular initiating events generally only cover one molecular target, like TPO or NIS. And there are a number of ways that chemicals can disrupt thyroid hormone synthesis outside of just the MOAs that are included in our particular assay. Because NIS and TPO are 2 of the primary targets within the system, but it wouldn't screen out any chemicals that act through the trafficking of thyroid hormones outside of the thyroid gland, or it wouldn't include any kind of metabolism. So it is limited in that respect, but the goal is not to use this as a standalone assay for determining whether a chemical has the potential to disrupt thyroid hormone synthesis or other aspects of the thyroid hormone pathway. It's used to get a more mechanistic understanding that if these chemicals do cause thyroid effects or do have effects on these different molecular initiating events, how does that translate to whether or not it disrupts the actually key event of thyroid hormone synthesis, which then is associated with these kind of downstream negative effects?
Right. And I'll just say there was another question that was you basically answered at the same
Oh,
time. It was sort of along those same lines. So
okay, great.
thanks very much, both Jason and Clara, for your questions. I had one more quick question. So it really good specificity numbers, but there were a few chemicals that weren't picked up that were supposed to be picked up. Do you have any, have you looked into why that might be?
Yeah, and I'm currently looking into them. So you're talking about the false negatives.
Yeah.
Um, and so one of those was potassium bromide. So potassium or sodium bromide, um, according to the literature, is stated as a strong NIS inhibitor. But the the concentrations or the doses that have been used far exceed what we tested. So if I think one of the studies that I looked at when I converted it from ppm to micromolar was like 9,000 something micromolar compared to the maximum concentration that we tested at 100 micromolar.
Okay.
So I think there are some dosing effects that could affect results. And there are a few others that I'm still currently looking into.
Okay, great. Yeah, I think it's one of the, you always see sort of these confusion matrices and you look at just the hard numbers. And what we always find with validation studies is when you look into what we thought the answer was supposed to be for that chemical, it might not actually be, um, you know, the case. So yeah, it's always a challenge. Um, okay. Well, we don't have any more questions for you, so let me thank you so much for your presentation, Dr. Pereira. Thanks for answering the questions.
Oh,
And
thank you, Christy.
congratulations on your work. And we'll go on to Raymond Hu, next presenter.
So I'm gonna share my screen. Uh, uh, actually, Dr. Pereira, you have to close the. Oh, okay, it's done. Okay, so everything works,
Yes, I can see it full screen.
right?
Sorry.
Okay. So thank you, Dr. Pereira and Dr. Pradeep. Uh, your presentation is amazing, and I've learned a lot. So today. I think good morning, everyone. It's really nice to see you here, and it's really a good opportunity to share our project, and it's my pleasure to be here. And so, thank you for the opportunity again, and I hope we are all having fun. My name is Raymond Hu from Brunger School of Public Health. So today we're gonna talk about our joint project with Risk Science Consortium. As you can see from the title, we're going to talk about the creation of a curated database of skin sensitizers released from medical device. So in simple terms, we are trying to answer a very important question. What chemicals coming from the medical device might cause skin allergy, and how confident are we about the evidence? So the project had three main goals. First one is we want to create a database, of course, uh, the list of chemicals of device-related skin sensitizers. So the second one, we want to apply the weight of evidence approach to help guide future studies to let researchers know which of the chemical or categories are understudied. And the third one, we want to evaluate how reliable are the current prediction models, like the QSAR models. Uh, how reliable are they when applied to device-related scenarios? So why is this work very important? There are several reasons, and the best answer upon this is we really need a sorted database at this time. Firstly, as you can see, there is an ongoing effort to develop a proposed skin sensitization IATA for compounds extracted from medical device. So our database supports that regulatory framework. It can provide a very structured, high quality data to help build that system. As you can see, there's many large pharmaceutical industry are responding to this framework. And you can also see that regulators cannot rely on a scattered literature, but unfortunately, that's what we have now, especially in a very specific case, very specific field like the medical device use. So ideally, there must be something that makes the evidence being systematic and traceable and defensible like a system or a list. So that's what we are working on right now. And there's also many reasons associated with the qualification of norms. We need to summarize the accurate data for the assessments and separate the human data, the toxicological study, and also the final in silico assessment. So talking about norms, we are also trying to use the actual clinical data to cross-testing the effectiveness of the prediction models, like the Toxtree, the Caesar, and etc. And lastly, we're trying to create a portal that helps the clinical workers like the dermatologist and also the patients to actually use the list to identify the common device-associated skin sensitizers. So the project isn't just a regulatory theory, it can also directly help the clinicians and patients. So as you may realize, it's not the clinical worker's job to do the actual risk assessment. Uh, so data from the publications must be analyzed or even translated to actually help the clinical works. And we are now trying to build a bridge between the gap. Now let's talk about what we did. As you can see, we have a pretty complicated flowchart here, but you don't have to worry about it. The main goal here is to build a robust and comprehensive literature collection as much as possible. And as you can see, we have two workflow that works almost independently. The first one is the chemical list filtering, and the other is literature search and review. And we are gonna talk about it later. And finally, the third step is we are going to perform a weight of evidence process to create the final list. As we've mentioned, the first workflow includes the direct filtering of a two large chemical list. On the left side, you can see we are trying to gather all tested skin sensitizers data. It can be in vitro, in vivo, or even in silico, but in silico is very rare in this case. And we are also trying to, you can see on the right side, we are trying to gather as much as possible the chemical or maybe the contents from the medical device. But this is pretty hard to gain for many reasons. So that's what we are trying to working on right now. So we spend a lot of time sourcing and developing both lists, and we have a good result eventually. So the second workflow is more like a traditional literature review and data extraction, and we revealed a lot of cases and epidemiological studies in basically in many regions, and it works pretty well. So after combining all the data sets, we identified about 62 chemicals that appears from both workflow output. And unfortunately, we excluded a bunch of chemicals from the final list uh, due to lack of human data. But as you may realize, this excluded portion is where we need more clinical data to determine their chemical properties and maybe some more analysis in order to solve more and more the skin sensitization cases saying the allergy is caused by unknown reason because we don't know how to determine that chemical. So uh, by by that we're likely to have a target for future studies. Uh, yeah. So after curation, the current list contains about 196 chemicals. And also you can see this table here. This table shows the most frequently reported skin sensitizers released from medical device, along with the associated product types. You can see most of them are acrylate, and from many are from adhesive products. So uh, therefore, we're also establish a new project on acrylates following this main project. By saying this, I want to express that it is very important because it helps us identify patterns of the skin sensitizer. Like certain materials or like device categories like adhesives may contribute more to the actual sensitization risk. So this kind of insight is very helpful both for the manufacturers and clinicians, which makes sense because if you are producing adhesives, you have to be more careful about the content, especially these listed chemicals. And the last part from my work is the weight of evidence. For clinical data, we consider mostly the study quality and the sample size, which is pretty intuitive. And for the in silico methods, we are evaluating the like the positive and negative predictive values, and also the EC3 characterization to indicate the actual chemical potency. So we're basically using the in silico methods to cross-check the data, and I'm here to consider their outputs and come up with a weight of evidence result. The main idea of using this weight of evidence method is to move beyond yes or no classification and actually characterize like the confidence and the strength uh, of this chemical. So we have more energy to push forward to the next step. And the last one, how are we going to use of the results? So this is just a reminder since we've been talking about the application before. And first one is we are gonna characterize the chemical space and skin sensitizers, which helps the prediction model, the QSAR model works better, uh, especially in the medical device use scenario. And secondly, we are evaluating, like I said, cross-checking the QSAR model's performance within this context. So third one is we're planning to make this list accessible for dermatologists and patients, which will help them to having a informed decision. And ultimately, the goal of this whole project is to have safer devices and fewer unexpected allergy reactions. So to promote patient safety and also to promote clinical work outcomes. So this is our joint project, and I'd be happy to take any questions. And thanks again for the opportunity. And okay, so if there are any questions, please.
Thank you, Mr. Hu. That was really a nice, clear presentation. And I really enjoy the link between kind of the laboratory work, which we're toxicologists are quite familiar with, and the kind of clinical outcomes and the connection to the clinic. Um, I was just wondering if, as you make the list available, are you thinking about any additional connection with maybe with specific clinics so that clinical experience can check the list, right? Like
Yeah, I know.
we have, yeah.
It's something like the promotion in the system. So what we are trying to do is to combine the list or maybe to design a like interface in their daily system. And
Mhm.
uh, we're not thinking too far, but we can also try to design a like alarm system like um but that could be more complicated because it could be associated with certain suppliers, like their products is less safer. We don't want to do that, but um, we could come up with a alarm system that help them make more better decisions. Yeah.
Mm. Yeah, that's interesting. We have a question here coming in. Yeah. Do you have plans to contact dermatologists to get human data for some of the chemicals that are currently excluded from the list?
Yes, we are trying to do that via the JHU system, and we are working with dermatologists and clinicians, and so that could be a long run because they have to find the actual patient who is positive with the patch testing. So uh, we're just planning on that, and we hope it could be um, more. I don't know, let more people get involved with the project.
Great. Okay. Well, thanks so much for your presentation. Thank you the for answering the question. Thanks to all of you for participating and asking your questions. I guess we will go ahead and end the webinar. I don't see any more questions coming in for you, Raymond. So very wonderful presentation. Thank you so much. Kenzie as well, thank you so much for presenting your work. And all of you listening, thank you for your attention. And we will see you hopefully on Friday and again next month with some more presentations. Hope you all have a great day.
Great. Thank you.
Thank you.